9/11, we've had some fun as our inaugural storefront studio show is underway. We're going to do this throughout the summer, we think, on Fridays. Have some giveaways all the time and lots of fun. Invite you down to say hello and give us a wave as well. It's gone well. We've also invited neighbors from the community to come and chat with us, none the least of which is our pharmacist, our friendly pharmacist from the medicine shop, Amyn Kanji. Good morning, Amyn.
Good morning.
Tell us a little bit about, I popped in the other day and was asking you some questions about allergy season. And are you getting lots of people asking questions about that these days?
Absolutely. This is the the time when we're full blown into spring, where a lot of people are complaining about allergies. So seasonal allergies, problems with sneezing, stuffy noses, watery eyes. Just all around not feeling great because of all the pollen and allergens that exist around us.
Puffers, friend or foe? Depends.
Friends, I guess, depending on the specific symptoms that one has. There's a lot of things that we have available for allergies. There's nasal rinses, there's oral medications, there's nasal sprays, there's eye drops that we can use specifically just for allergies.
So these are all over-the-counter things that we can do without having to get a prescription.
That's right. Yeah, there are quite a few products that are available over the counter, but once you find that one of the over-the-counter products don't work anymore, we move patients on to prescription medications, which is slightly stronger, probably more effective, because you do build tolerance to allergy medication after a while.
What's going on? Why do our eyes water or we sneeze? What is it that causes?
Well, it's anytime you're exposed to an allergen, your body produces histamine, which commonly breaks down the cells, which causes the watery eyes, the sneezing, the runny nose. And so allergy medication are typically antihistamines. They block the histamine production from the cells. And histamine is typically released in response to any sort of pollutant, any allergen that's in the air. But not everyone reacts to allergens. They're unique in the sense that what I may react to may not be something that you may react to, right? They're all unique allergens that cause specific reactions.
You brought something a little funky in for us, and I was hoping that Gord was going to demonstrate, but apparently he's not going to.
Right.
But tell us about the nasal rinse, because this is something you believe we should just be doing on a regular basis.
Absolutely, yeah. Especially if you have seasonal allergies and, a lot of stuffy noses, if you're sneezing, if you're allergic to dust or smoke, with the fires right now as well, too. It's probably a good idea to make sure that you're taking care of your nasal passages. Just like we brush our teeth every day, we floss, we bathe every day. It's really, really important because we breathe a lot of allergens through our nostrils. And so it's really important to take care of our nasal passages and rinse them on a daily basis.
So you brought in this packet, and if you've ever lived in Ontario and you had the bags of milk,
you're right, that is what it's like.
Visualize a double bag of milk here, but it's called Rhino Rinse, Premix Nasal Rinse. It's for sinus congestion, allergies, rhinitis, colds, pollution, dryness, smoke, dust. So what's in this and what do I do with it?
So this is a sterile water that's made in a lab where they make IV bags. You have to be really careful when you use tap water because you can introduce a lot of bacteria, especially when you're pushing the fluid up your nostrils. You have to make sure that the water you're using is sterile, so free from bacterial contamination. So the Rhino Rinse is a sealed bag of pretty much water, but it's sterile water that you would use using a contraption called a nasal rinse bottle, which squirts the water up one nostril and it actually flushes it down the other nostril.
Oh, that sounds like fun.
Yeah. So it's got like the squeezy thing,
That's right. Yeah, absolutely.
And it doesn't hurt or anything. And
it doesn't hurt.
And blowing your nose is not good enough. This is something that you think is really important.
This is something that actually cleans the nasal passages completely from the inside out.
Now, you say this also helps with, the allergy season. So is there something in the water that helps, or is it just getting it clean?
It's just getting it clean. Yeah, this is only one step. You still may need to take your antihistamines or use nasal sprays, but this is just a way of getting rid of all the pollutants that sit in your nasal passages.
When I go into the pharmacy and I see the choices I have for things like you mentioned, Reactin and everything, how do you determine what works for you?
You know what? It's trial and error.
Really?
Right. It's trial and error. What works for one doesn't work for another. And sometimes, there's one that works for specific individuals, but after you take it for a long period of time, your body does build resistance. So then you have to move to a different type of antihistamine.
And should we take them regularly? Should we even do this nasal rinse regularly?
Absolutely.
How often should you be, if it's kind of peak allergy season, how many times a day or how many days in a row should we take pills?
You can safely take the medication on a regular basis just to get you through the allergy season. Obviously, if you don't need to take the medication, you can control your symptoms without taking medications. That's probably the first step. But most people find that they do need to rely on antihistamines just to get them through the allergy season.
For me, it's just, I just do it at this time of year. It's probably 3 weeks. I'll mix in one of them, and I never know what I'm buying, whatever usually is on sale or is the knockoff, but it seems to work.
Yeah, absolutely. Yeah, and you only do it for the allergy season, and then once the season's gone or there's stuff that's not pollinating in the air anymore, you can certainly stop using the products as well.
Is the premixed nasal wash expensive or not bad?
It's not bad. It's reasonably priced. You're paying about $12.99 for water, but it is sterile water, so it does prevent you from getting any infection or introducing any infection into your nasal passages.
And may, in fact, make you feel much better.
Absolutely.
And the squirting device is
$12.99 as
$12.99. Okay, for $25, you can too squirt clean water in your nose, but help out on allergy season. Thanks for popping by.
Yeah, you're welcome.
Good to see you, neighbor. Pharmacist Amyn Kanji.